When we're looking at our blood pressure number, it's giving us an idea of the level of minerals in the system, also blood glucose, protein a little bit, and even filth and junk that hasn't been properly removed from the body. So if any of these things are higher than they should be, they can thicken up the blood, and then that causes the body to raise the pressure needed to push it through the system. Think about it. What would be easier to push through the veins? Something similar to red wine or pancake syrup? Pancake syrup would be harder to push through the system. It would need more pressure to get it through the system. So when we see high blood pressure, it often means that one of these things has gone high, or a variety of them have gone high, and thickened up the blood and increased the pressure needed to push it through the system. Higher levels of blood sugar can thicken up our blood. That's why we often see high blood pressure go right along with type 2 diabetics. They have a higher level of sugar in their system, and that sugar can thicken up the blood and raise that blood pressure. That's why it can be nice to look at your blood pressure in conjunction with your fasting glucose number. You can get a glucometer pretty cheap at any pharmacy, and you can check your fasting blood glucose number as soon as you wake up. Check that number then, and if it's 100 or higher, that's an indication that your blood sugar is leaning higher than it should. If that's the case, you know that part of what's making your blood pressure number higher could be glucose. And when we see people bring that fasting glucose number down, we often see blood pressure come down right along with it, because the blood is not so thick now that it has less glucose thickening it up. When we see blood pressure that's too low, maybe a systolic number under 112, that can be an indication of maybe some of these things are too low, especially minerals. That's very common to see very low minerals in the system when we see low blood pressure. This seems to be most commonly caused by digestive malfunctions that are restricting the person's ability to properly break down their food and pull the minerals out of that food. Blood sugar may also be going low if a person's dealing with hypoglycemic type issues, where blood sugars may be going too low, and then we see that blood pressure really come down. Either minerals or glucose going too low can create a lot of problems. The body uses these minerals in the system to send signals from the brain down to the body and from the body back to the brain. When there's not enough minerals and a person has really low blood pressure, we often see issues like ADHD, depression, chronic fatigue, anxiety, and a lot of issues like that. Now, all those things I just listed have other possible underlying causes as well, but low mineral levels is often at least a contributing factor.